Juliana Ome is the name. Today we're looking at a crucial topic, a procedure many mothers are afraid of. Most mothers, especially first-time mothers, are so afraid of this thing. This thing is a cut, an incision. So the topic for today is episiotomy. By way of definition, episiotomy is a cut done for a woman during childbirth to help widen the area the baby will pass through to come out. This cut is given at the point of delivery when the baby is coming out. The doctor or the midwife attending to the woman must have noticed that the place is too tight and the baby cannot come out without tearing the woman before giving this cut. So episiotomy is done at the vaginal opening when the baby is coming out, and this area is called the perineum. Please, there's a health talk video on my channel that explains what the perineum is. The link is attached to the description box of this video. Do well to watch it. So why is episiotomy done? Why will anyone cut an innocent woman just because she wants to give birth? First, the main reason for episiotomy is to enlarge the vaginal opening to facilitate the safe delivery of a baby. Episiotomy is also done to prevent or minimize overstretching of the muscles around the vagina. If the vagina is too tight, as baby is coming out with force, the perineum must give way for the baby to pass. So episiotomy is done to ease this tension. And if this cut is not given, the baby may tear the perineal muscles, and there is no control over the extent of this tear, as opposed to when a midwife or a doctor gently gives a clean cut. Also, if a baby is not breathing well, either the heartbeat is too fast or too slow, indicating a need for an intervention, episiotomy will save the baby some extra stress and time and make the baby come out faster during delivery. If a baby is coming out with the buttocks, it is called breech presentation, you will need an episiotomy so that when the buttocks passes, the head, which is bigger than the buttocks, can also come out. And again, if a baby is premature, episiotomy is done to protect the fragile skull of the baby from injuries. The head of a premature baby is tender and it can easily be injured if the baby's head is squeezed through a tight perineum. So episiotomy is done to protect the baby's head. So when is episiotomy done? There's a set time for episiotomy, and this will need a special skill so that the cut is not given too early or too late. If the cut is given too early, the woman will bleed from it and it can be dangerous. If it is given too late, the harm you're trying to prevent may have taken place because the baby comes out with force, and any delay can cause the baby to tear its way out. So before that happens, you ought to give a clean cut at the right time. Mothers, please deliver in the hospital. That is where you have professionals who know how and when best to give an episiotomy. Now, are there special precautions to take note of in giving episiotomy? Of course, there are precautions to take. First of all, the area where this cut is given has blood vessels, nerves, and other structures. So the knowledge of how that area is will help the doctor or the midwife to know how to position the scissors while giving this cut. So mothers, don't be scared. When a doctor or a midwife tells you you will need a cut, your baby is protected and you are also protected. And before the cut is given, an injection is given around the vagina so the woman does not feel a pain when this cut is given. So how is episiotomy repaired? Is the woman allowed to go home with the cut? No. Immediately after the delivery of the baby and the placenta, the doctor or the midwife will stitch the cut to allow the place to heal well. After stitching the episiotomy, the doctor will prescribe some medications for you. Please take the medications properly and adhere to all the instructions given you. Unfortunately, when some women go to some local delivery homes or traditional birth attendants' home and they sustain an injury by the baby, these local midwives do not have the knowledge of episiotomy, so they leave the woman to go home like that, and this further creates a problem for the woman. Sometimes the place gets infected, the mother is unwell after delivery, she has fever, she's unable to care for herself and her newborn. An infection can cause a woman to die after childbirth. It is called sepsis. So please, amazing mothers, the role of bringing new life into the world is a special role. Do well to give yourself a special care. Go to the hospital and not a local midwife's home. So what are the advantages of episiotomy? Now, because episiotomy is a clean cut, it is easy to stitch it back and it heals better than when a baby tears the mother. You know that episiotomy is an intentional cut, so it is well directed and the damage is minimal. But when a baby causes tear for the mother, it is not directed and the mother can sustain multiple tears. Also, episiotomy reduces the time a baby will take to come out because the cut will remove the obstruction by the perineum. And then episiotomy serves as protection for the baby's head, the brain, and blood vessels and so on. Because the baby's skull is tender, it means that if it's compressed, the brain can also be damaged. So an episiotomy will help to minimize injury to the brain, especially in premature babies. So episiotomy is not only when a baby is still big, so even when a baby is premature, you need it. Another protection it has for a baby is the prevention of injury to a baby's shoulder. Some babies are so big, and after the baby's head is delivered, the shoulders get stuck. And if care is not taken, that baby may be injured if pulled out so hard, and it can lead to paralysis of the whole arm. The nerves that allow you to move your hands and do stuff with your hand, they come out at the shoulders under the skin. So injury at this area is very dangerous. I've once seen a baby brought to the hospital for care with a paralyzed upper limb because she was a big baby at birth and she was forced out. In that process, the nerves that supply her limb were injured. But with episiotomy, this can be prevented and baby will be delivered intact. Episiotomy also serves as protection for the mothers because some mothers were circumcised when they were babies, and what God placed in the vaginal area to help open up during delivery cut off in the course of circumcision. So in the process of delivery or childbirth, such a mother can injure down to her rectum or even to her urethra where she urinates from. In this situation, a timely cut by a midwife or doctor will help prevent her from this type of dangerous injury. Now, mothers, I want you to pay attention to this because there are ways to care for an episiotomy. You have special care to give to this area. Some mothers have had to be restitched because they were not careful enough and the stitches loosened and opened up. First of all, the area where this cut is given should be clean and dry. Take your bath at least twice a day and wash the area gently while bathing. The wound should be cleaned very well after going to the toilet to urinate or to poo. After pouring, wipe from front to the back, one stroke please. Don't let feces touch your wound. Wash gently and dry up. And once you go to the toilet to poo, change your pads afterwards. Then diet. Eat foods rich in fibers, vegetables and fruits. Drink lots of water. This will help prevent constipation so your stool will not be hard. You don't have to strain while using the toilet. Then change your pads regularly. Mothers, your stitches don't have to be removed. Stop touching them with your hands. Your body will absorb them over time, okay? Then mothers, bond with your babies. Breastfeed your babies regularly and rest. Allow people around you to help you. Enjoy your support system. Rest improves your healing and your immune system in general. So take time to rest after delivery and build up your immune system. Then avoid sex for some weeks after your delivery so that you can heal properly. Having sex immediately after childbirth can be very painful and discomforting. Some women feel like they have so much wound in that area after delivery. They feel sore. So it is better to wait for episiotomy to heal. The normal discharge has stopped. Your stitches have been absorbed by your body, and this may take several weeks, so be patient. You can also do some exercises during this period. They are called Kegels. These exercises will strengthen the muscles around your vagina and anus, and they can improve healing. And you can do these exercises when sitting down or lying down or breastfeeding your baby or changing baby's diapers. In fact, once you are awake, you can be doing your exercises and be doing other things. You don't have to register with a gym to go for this exercise. Meanwhile, the details of these exercises is in a separate health talk on my channel. The link is attached to the description box of this particular health talk. Now, there are different ways to manage pains after delivery. Most women feel pain and discomfort after delivery, and the discomfort is greatest in women who sustained tears or were given episiotomy. Now, there are various ways of relieving this pain. First of all is the use of ice packs. just place a pack of crushed ice in your perineum. This will help to reduce swelling and also reduce pain in that area. It is very helpful, especially in the first 24 hours after you deliver your baby. Then by the use of heat. Now get a bowl that can carry your weight. Pour in boiled water in the bowl, add some salt to it, and touch the water with your hand to be sure you can tolerate the heat. Then sit on the bowl and allow the water to touch your skin around the perineum, and then sit directly on it for about 30 minutes. Repeat it 2 or 3 times a day, maybe when you take your bath. This thing I just described is called a cis bath. You do it without pants and without pad, directly. Please, hot water can melt your stitches, so make sure the water you use for your cis bath is not so hot. In fact, for you to know the temperature is enough for you, make sure it's something you can scoop and pour on your face. If you cannot do that with that kind of temperature, you can't use it for cis bath, okay? And again, sometimes your doctor may prescribe some medications for you, an aesthetic spray or creams or pain relief pills. Do well to take them and don't engage in self-medication, please. Some pain relief pills are not allowed after delivery and during breastfeeding because they can cause constipation and they can even affect your babies. So please follow your doctor's instruction strictly. Thank you. Then sit on comfortable seats, maybe fluffy pillows. You can use exercise balls. This will help improve healing. Now, there are problems that can arise from episiotomy. These are called complications. Some mothers can bleed severely from it. This can become very painful. The stitch can loosen and the wound will open up. Some mothers can lose control over their bladder and they leak urine when they cough. That being said, please, after delivery, mothers, while taking care of your babies, take care of yourself too. Amazing mothers, if you experience any of the things I'm about to mention, go and see your doctor. If you experience fever or chills, bleeding, or your stitches are becoming more painful or smelly, they can be signs of infection, or the stitches are loosening and you have severe pain, or you have an unpleasant odor from your vagina, or your perineum is swollen. Please go to your doctor immediately, okay? Dear mothers, you know what knowledge does for one, right? Knowledge brings liberation. I met a woman who, after 4 years of delivering her last baby in a TBA delivery home, she was still in regrets for not going to the hospital for that delivery because she sustained a cut that was not stitched. And according to her, her vagina is so disorganized, it's too open. So she came to the hospital for help and she was not happy at all. No need to be afraid, mothers. Go to the hospital. I've put this health talk together to help us have the proper knowledge on how to take care of our health. If you have any complaints, go see your doctor. Of course, if you know better, we will surely do better. For first-time mothers and other-time mothers, everyone, do not shy away from hospital delivery because of an episiotomy. Use the things you have learnt from this particular health talk video in your favor. Give permission for episiotomy to be done for you. And after you have been discharged, do your best to keep the place clean and healthy, as we have already explained. And in a matter of weeks, you are good and intact down there. And please, the information contained in this video is not to replace your visits to your doctor. Do well to keep to your hospital visits and take all complaints to your doctor. Thank you very much for staying to the end of this particular health talk. If you're yet to subscribe, please go ahead and do so, and do well to click on the notification bell for subsequent uploads. Thank you so much and see you again.